discuss about the normal adult glucose values. So what is glucose? So glucose is a monosaccharide found in the fruits and is formed from the digestion of the carbohydrates and the conversion of the glycogen by the liver. So we can say the glucose is the main source of cellular energy for the body and is essential for the brain and erythrocyte function. Okay. So next we will discuss about its normal value. First is glucose fasting. What is glucose fasting test? So glucose fasting test, it measures your blood sugar after an overnight fast. It should be 70 to 110 mg per deciliter. Okay, so the fasting blood glucose levels are used to help the diagnose the diabetes mellitus and the hypoglycemia. Okay, so what are the consideration? What are the nursing considerations before this fasting blood glucose? What you have to do, you have to instruct the client to fast for 8 to 12 hours before the test, and you have to instruct the client with the diabetes mellitus to withhold the morning insulin or the oral hypoglycemic medications until after the blood is drawn. Next we will discuss about the glucose monitoring capillary blood. Previously it was also known as the CMBG. What it is? The self monitoring of the blood glucose. We can say it is the one way for the people living with the diabetes to measure and assess their glucose level. What it is exactly? You can see it is the capillary blood glucose. Okay, test. So capillary blood glucose test uses a drop of blood from a finger prick to get a blood glucose reading using a glucometer. Okay, so it should be 60 to 110 mg per deciliter. Next we have glucose tolerance test. Glucose tolerance test is what? It is this glucose tolerance test aids in the diagnosis of the diabetes mellitus. If the glucose levels peaks at the higher than normal at 1 to 2 hours after the injection or the ingestion of the glucose and are slower than the normal to return to the fasting level, then the diabetes mellitus is confirmed. So the baseline fasting, it should be 70 to 110 mg per deciliter. After 30 minutes fasting, it should be 110 to 170 mg per deciliter. After 60 minute fasting, that means your 1 hour. After 1 hour, it should be 120 to 170 mg per deciliter. After 90 minutes fasting, it should be 100 to 120 mg per deciliter. After 120 minutes fasting, that means after 2 hours of fasting, it should be 70 to 120 mg per deciliter. So multiple blood samples were taken to test this test. Okay. Next we have glucose 2 hour postprandial. See what is 2 hour postprandial test? A 2 hour postprandial blood sugar test measures the blood sugar exactly 2 hours after the start of a meal. We can say this blood sugar test may be used to check for the diabetes and to see how the treatment for the diabetes is working. See, for this test, okay, it should be less than 140 mg per deciliter for the normal patients, for the normal patient, and for the patients who's having the diabetes, it should be less than 180 mg per deciliter. Okay, so hope this video is helpful to you all. Thank you all.